Okay, this lecture is going to address social work as a profession and a program of study. So, social work is defined as the applied science of helping people achieve an effective level of psychosocial functioning and affecting societal changes to enhance the well-being of all people, and that's pulled from Barker. NASW, the National Association of Social Workers definition, is the idea of social work as a profession promotes social change, problem solving, and the empowerment and liberation of people to enhance their well-being. And the focus is on human rights and human justice, and kind of social justice that way. In terms of the NASW, from the working statement on our purpose as a profession, the focus is to improve social functioning and social conditions. And as goals, we are working to enhance social functioning, linking clients with resources, improving kind of the delivery of those services, and of course promoting social justice, which often happens through social policies. Our social work mission is enhancing, again, well-being, kind of looking at the well-being of the individual and their social functioning, but also looking at society as a whole. And I think what makes, for me, what drew me most to social work was two things. One, this idea of this person in their environment, or what we call PI, and that's something you may have heard about in your human behavior class. And so it's not just looking at the individual and maybe their behavior issue. Maybe there's a child who has a behavioral issue in school, but it's looking at that child and that behavior, and it's looking at the school setting and the family setting and perhaps their neighborhood and community, and involve in kind of the larger involvement that way. So recognizing that it's kind of the individual is in a context, and that we need to kind of think about these environmental forces that maybe create and contribute to and work to address those issues in order to help the client solve the problem. So again, a child with a behavioral problem in school, it's maybe a larger issue that way. And so again, looking at both the individuals, again in that social context, and the well-being of the society as a whole. And so that's what we talk about, kind of this dual focus. The second thing that kind of drew me to social work was this eclectic kind of knowledge base, looking at our values as a profession, but also many different theories that guide our practice. And there's many theories that you have perhaps started to learn about in your other courses, perhaps human behavior, or will learn about. But there's so many theorists. You know, if you think about some of the child theorists, Piaget, and as an example, and of course there's cognitive behavioral therapy, or behavioral therapy, or behavioral theorists, and cognitive behavioral theorists, and motivational enhancement theory, and so kind of all of these theories guide our practice. And so there isn't just one way of looking at things, but these theories guide our practice, help us think about the interventions to take with our clients, that we're seeing a change for our clients at many different levels, and that we're doing that both through helping a client directly, maybe individually working with them, or perhaps even through policies. We're helping a policy that, we're promoting a policy that changes the support for, or supports the organization that's kind of treating that client. And of course, research is guiding our practice. We're looking at working with client systems at all levels, and working with many different organizations. So again, I think what drew me is this idea of the person in the environment, that we're looking at not just kind of that child's behavior, but that whole larger picture. And then that in terms of this generalist social work practice, there's these different theories that are guiding our practice, and we kind of pull from many of them, and of course our professional values and ethics guiding our practice. That's kind of what we'll be talking about. You can be doing this working with clients individually, or up in kind of in between the meso level, or be working with clients on a larger perspective in terms of bringing about a social change, maybe in a community level or in a neighborhood or in a society. So I think, again, what you can do with social work is that you can work to apply all these different theories to the individual level or kind of the macro level, the larger level. And as social workers, we have many different roles, and these are just kind of naming a few here as advocates and educators, counselors, brokers, or mediators. But we also are oftentimes playing many different roles, and I think that's what's amazing about social work is that you can be working with many different populations. You can also be working in many different roles, and in one day you may have a role of advocate and educator, or mediator and counselor, and so each day is different because of that, because of the work that you're doing. Each day is different because of where of the role that you're playing. I guess I wanted to tie all of this in terms of when we think about generalist social work practice and kind of the theories that are guiding our practice, is that I'm not sure where this course is in your sequence of courses. Our core curriculum is the human behavior and the social environment, social welfare policy, research, and of course social work practice methods course and field. So whether you're taking this as your first course or you're taking this corresponding with a policy and or human behavior course, you're learning many different kind of concepts. But I don't want you to think about these courses as individual columns of learning or individual towers of learning, because that's not our intent. Our intent is that this should be an integrated curriculum. So what you're learning in human behavior, you can apply here in 240. What you're learning here in 240, you can take and apply to your policy classes. Of course, all along you're learning about research and guiding, gaining scholarly sources. So your research, you're going to be guiding your practice in your other coursework as well. So again, kind of thinking about these courses are not just individual towers of work to be done, but are this integrated concept and curriculum that are helping you be a better social worker. And if you can start to think about that process of integrating that and keeping that all connected and applying it to many different classes and many different ideas that you're learning, you can be a better student and a better social worker that way. And again, when you get out there in the field, you'll be doing the same thing. You're constantly kind of taking in information from your clients and from your setting and from your from your readings or from your research, and kind of molding yourself and applying that. So who are we as social workers? We are a profession. Certainly we have a knowledge base and a skill set. We have to adhere to specific values and ethics of our profession. We are working to empower, to make changes. We're working with others, partnering with clients and colleagues and other agencies to make changes. Since we are a profession that way, we are licensed. We are a licensed professional, and we'll talk more about that in a few minutes. But let's start talking about kind of what guides us as a profession in terms of our ethics. The NASW has established kind of a professional code of ethics for us, and it really is a framework to guide our ethical decision making. It's not going to tell you what to do in every situation, and that's where ethical decision making kind of comes in. But it's kind of this abstract guide for you to start, for us to be the best in terms of our profession, or providing the best services as a profession. There are several principles that are guiding our practice. The service, which is helping those who are in need. Social justice, which is pursuing social change and challenging injustices that we see. The dignity and worth of a person, which is respecting our clients' right to choose what is best for them. We can't make them do what we think is best. The importance of human relationships, that we as a person are making a connection with others, and that working relationship is what oftentimes brings about a change. The idea of integrity, being truthful about kind of our capabilities and our competence, and also maintaining confidentiality, and certainly maintaining our competence, being a competent and practicing within our skill set and knowledge base. We are kind of bound to our clients, our colleagues, our practice settings, our other professionals, our social work profession, and the broader society. So you can see how sometimes our code of ethics can be in conflict, whether it be providing a service and the dignity and worth of a client may be in conflict, or kind of providing a service to a client versus making sure we're kind of providing the service in our practice setting. So we'll talk more about kind of ethical dilemmas in a future date, but again, thinking about kind of our code of ethics that way as a start. UMBC is an accredited social work program, and we are one of 474. We are actually one of the larger social work programs in the country, and this just reviews kind of different accreditation